let's talk about red cell distribution width, RDW-CV. The optimal result is between 11.7 and 15.4%. The RDW value tells you whether enough of your red blood cells are of normal size and shape. So why is this important? The red blood cells are usually flat and lenticular, disc-shaped, with a diameter of around 7.5 micrometer. What's the function of red blood cells? The sole function of red blood cells is to transport oxygen to different parts of the body. Let's describe a few terms first. Blood vessels. Blood vessels are anything that carries blood. There are three major types of blood vessels: arteries, veins, and capillaries. Let's take a closer look at arteries and veins. Arteries are blood vessels responsible for carrying oxygen-rich blood away from the heart to the body. Veins are blood vessels that carry blood low in oxygen from the body back to the heart to reoxygenation. Capillaries. Capillaries are tiny blood vessels connecting arteries to veins. These blood vessels carry oxygen and nutrients to individual cells throughout the body. Okay, back to the red blood cells and the distribution width. Blood cells must squeeze through the body's smallest blood vessels, the above described capillaries, to do their job. But capillaries often become narrower than the cells in their normal disc shape. Capillaries can be as small as 4 micrometer in diameter. So the cells must deform and curl up to fit through these capillaries. Remember, a normal red blood cell is around 7.5 micrometer in diameter. Only when this process of squeezing through capillaries can happen, the supply of oxygen is guaranteed throughout the whole body. Some red blood cells are, however, not optimally formed. To a certain extent, this is normal, as there are 2 million red blood cells formed per second. Usually, there are around 85 to 89% of red blood cells develop properly. By looking at the red cell distribution width, RDW, value, one can see how many red blood cells have a deviating form factor. If 85% to 89% are usually normally developed, the RDW value then should range between 11% and 15%. That's the optimal reference range. What are RDW-SD and RDW-CV markers? RDW-SD and RDW-CV are parameters that are analyzed as part of the red blood cell analysis. CV is a coefficient of variation and SD means standard deviation. One important factor to mention now is that when we're looking at the red cell distribution width, we're not looking at the actual width of the individual red blood cells. We're looking at the width of the curve that the blood analyzing machine spits out. So a higher or lower RDW-CV value would not indicate how much bigger or smaller the actual red blood cells are, but rather how big the variation in cell size and volume is. Mathematically, the RDW-CV is calculated with the following formula: standard deviation of MCV divided by MCV times 100. The RDW is an actual measurement of the width of the red cell distribution curve in femtoliters, FL, and not percent. The width of the distribution curve is measured at the point that is 20% above the baseline, and since the RDW-SD is an actual measurement, it is not influenced by the MCV and more accurately reflects the red cell size variance. The RDW-SD normal value, which is the width of the volume curve, is between 39 and 46 FL.